We've just been hearing from a doctor there talking about the fight that the NHS is putting up to try and get this virus under control. But of course, long term, we have to think of a way out of the lockdown. I just wonder what in your view, is the most likely way out of the current restrictions that we see ourselves in?
Well, it's not by herd immunity, that's for sure. I think the government's taken the right path now, eventually. I think the 2-week lockdown has given the NHS a fighting chance. And I think what we need to do now is not just wait for the vaccine. What I think will happen is that we'll get better at testing. Hopefully we'll get the protective equipment that the NHS needs. We'll see that curve flatten out so that there's not the kind of overwhelming pressure on the NHS that would have happened had we not taken these measures, which would have all kinds of ramifications, because virtually it would bring the NHS grinding to a halt and they wouldn't be there to protect us. And then we see this gradually dying out. I mean, the last outbreak of this kind, i.e. The last coronavirus pandemic, was 2002 with SARS. Now, it never became a pandemic. Actually, it was confined to places like Korea and the Far East, but it eventually came to a halt. And I think that will happen here. But the kind of discussion and debate I'm seeing raising its head again about herd immunity is in effect, you put the economy before human lives, and I don't think that's acceptable to any of any political persuasion.
Now, you, of course, were Health Secretary between 2007 and 2009 during the swine flu pandemic. Of course, coronavirus, COVID-19 is far deadlier than that. But given the fact that we have experienced pandemics before, why weren't we better prepared?
That is the big question. I mean, you say, it ended up being milder than we expected, but it was the return of something called H1N1. The last time we'd seen that was Spanish flu in 1918. Between 500 million, it's calculated half a billion people caught it, and anywhere between 50 and 100 million people died. And it affected people. The younger you were, the more likely you were to get it. So it was terrifying, and 457 people died. But we were prepared. I don't say we were prepared because it's something great about a Labour government, but all governments have a risk register. And Conservative governments had a risk register. And on that risk register, top of our risk register, was a pandemic. We know they come along. There's been three every 100 years for the past 300 years. So we know they're coming along. And we were prepared for it. And so was my opposite number, Health, Andrew Lansley, prepared for it. We had debated in Parliament the national pandemic plan. We had the equipment set aside. We had everything in preparation. We had something called the Health Protection Agency, which vanished in about 2011. I'm not sure what effect that has had, but I am absolutely amazed at how badly prepared the government is for this. Number one on our risk register was this. Number two was the kind of terrorist attack that we saw in Mumbai for the first time. You remember back in 2007, where terrorists just ran riot with machine guns and just mowed people down. That had never happened before. So those two things were top of our risk register. We had dress rehearsals for them. When I first became Health Secretary in 2007, I walked straight into a dress rehearsal of how we would deal with with a pandemic, and how we would deal in this country with the kind of things we're seeing now.
At the same time, though, the government would argue that this kind of pandemic would overwhelm any health service many times over. And so how could they have been fully prepared for something like COVID-19?
Well, because it is a pandemic, and because pandemics, whether they are respiratory pandemics like this one or whether they are flu-based pandemics like swine flu, the basic things you need at the start is protective equipment for NHS staff. That doesn't change. The first thing you need is the arrangements for testing. That doesn't change to see whether people have got it or not. I actually think the equipment's more important, because that would stop frontline health service workers from actually contracting it. Testing is just to see whether they've got it or not. You can prepare those things, and you can have those things waiting. Face masks, which I don't think the World Health Organization.
Now, the government's been criticised for not locking down sooner, but in many ways, they're just following advice that has been in place for many years. I mean, you told a House of Lords committee in 2009, even in a full pandemic, people should only stay at home if they have symptoms. Do you still think that's true?
Yes, by and large, that's true. The difference here to swine flu is that we had antiviral drugs that helped with it. We distributed them to people. People could stay at home, have what we called a pandemic buddy, someone who wasn't affected to go and bring those antiviral drugs to them, and it would help them with the symptoms. It wasn't the vaccine, although the vaccine followed pretty quickly in 2009 when swine flu broke out. So that kind of help isn't available here because, as I understand it, there are no antiviral drugs that help with it. So if you're ill, actually, you're more likely to have to go to seek help from the NHS. But every time someone carrying this steps out of doors, they run the risk of infecting more people. And we don't quite know what the reproduction rate is of this, i.e. the number of people who catch it, the person who has it, but it's pretty high, I would guess.
OK. Now, I just want to finish the interview by talking a little bit about Labour. A new leader, Sir Keir Starmer, elected in the first round, a very resounding victory for him. Now, he, of course, has got a huge challenge ahead, bringing Labour back from the worst defeat since 1935. How do you think Labour needs to change?
Oh, we need to get away from this cult that has taken us over. I mean, Keir's this is absolutely the right first step. We've got someone there who I think is capable of leading this party back to victory, but goodness, he's got a hell of a job on his hands, and no one will be listening much to what he's got to say early on. But what he has said is exactly the right things. He's going to be absolutely productive with the government in solving this current crisis. The plea for unity, I mean, unity is fine when you've actually got rid of the problem that's caused the disunity in the first place. I mean, Momentum is an organisation devoted to internecine warfare. We heard from them yesterday. What did they? They didn't congratulate Keir Starmer. They didn't say anything useful other than we'll be watching him on his back all the time. And I'm afraid, there's no sign that they've buried the weapons and have dedicated themselves to unity. So he has to make sure that what's happened to us, including anti-Semitism, which came in with these far-left insurgents into our party during 2015, that we cleanse ourselves of those, that Keir Starmer has the right people around him, and we return to being a party there for people of whatever social class, in whatever part of the country, pursuing our two objectives of the eradication of poverty and greater equality.
I mean, pretty clear that you're no fan of Momentum or Corbynism more widely, but how do you think history will judge Jeremy Corbyn's leadership of the Labour Party?
Awful, dreadful. He's incapable of leadership. Now we've got a leader who is capable of leadership, and we'll be seeing him lead. But this whole concept of leadership is a problem for the far left. They believe that everything should be from the grassroots, which means a few activists pulling the strings. Everything is ideologically motivated, and we'll hear a big litany of why everything Corbyn did was right. We'll hear all that. We were almost wiped out, and if the wrong person had won that leadership election, it would have been the end of the Labour Party. Now we've got a chance, but it's a chance, and it depends an awful lot on Keir Starmer's leadership.